Welcome, everyone. We're so pleased that you're able to join us for this webinar on dystonia and physical therapy. My name is Janet Heischetter. I serve as the Executive Director of the Dystonia Medical Research Foundation, and it's my pleasure to serve as the moderator for this program and to welcome you to the program. There's a growing interest in learning more about how physical therapy, often called PT, can help in the treatment of dystonia. And we're going to learn more about that from our terrific speaker for this program. So again, we're really glad you're here. Before we get started, just a couple of announcements or reminders. This is a Zoom webinar, so everyone but our speaker will be automatically muted. We want your questions. They're an important part of this program. So please use the chat function to send us your questions. A number of people have sent us questions in advance, so we're looking forward to presenting those to our speaker. Questions that we don't have time to get to, we always utilize in the development of our educational resources and in developing articles for the DMRS magazine, The Dialogue. So please don't hesitate to send us your questions and send them when you think of them so you don't forget them. This program is being recorded, and we'll send you the link for the program in case you want to watch it again or forward it to someone else to view it. I want to thank Ipsen Biopharmaceuticals for their support of this program and all of our webinars this year. So now on to our program. We have a really wonderful speaker. Dr. Mary Hudson McKinney is a physical therapy neurologic clinical specialist with 30 plus years of experience in treating neurological rehabilitation in a variety of clinical settings, ranging from acute rehabilitation to outpatient and even home health. Dr. Hudson McKinney has extensive expertise in applying evidence-based clinical interventions for adults with dystonia and other movement disorders. She's a past contributor to numerous DMRF educational programs and a frequent guest presenter at the meetings of the Dystonia Support and Advocacy Group of San Diego. And I just give a shout out to our wonderful leader in San Diego, Martha Murphy, and all of our support group leaders for the work they do in presenting these kinds of programs and serving as a resource in their communities. We thank Dr. Hudson McKinney for her participation in the San Diego group and for her being with us for this program. Thank you again, Dr. Hudson McKinney, and I'll turn it over to you. Welcome.
Thank you so much. So I'm going to go ahead, and I have actually a couple of different slide decks that I'll be talking through. I'm going to be spending more time on the person with dystonia slide deck than I am another slide deck that I'd like to share with you. So I'll start with the exercise in persons with dystonia. So I'm going to share my screen. Okay. All right, and then I'm going to go like this. Come on, behave. Hang on a second, it looks really big to me. I'm going to go ahead and fix that. One moment, please. There we go. Oh. Okay, hang on a second. I don't know. Having a little bit of problem with my slide deck. Is there any way that you could assist me? Let's see. In decreasing the size. Darn.
We kind
there it goes.
You got them?
Oh, perfect. That's perfect. All right. So
okay.
I would
sorry,
like.
We can't see them. Just a quick thing. We're not able to see your slides yet.
I am so glad you said that.
Yeah.
Okay. All right, let's make sure you could see it. Is that better?
Very perfect. Thank you.
Okay, very good. Sorry for the delay, guys. So what I'm going to be talking about is I'm going to be going over exercise strategies in persons with dystonia, looking at a couple of different strategies that can be quite helpful in persons that are challenged with dystonia. So this is what I'm going to be covering. So I'm going to be going over why is exercise important, How can a person with dystonia stay physically active? We're going to be talking about some healthy habits that are helpful. And then there's a concept out there that looks at retraining the brain or emphasizing neuroplasticity to help a person engage and move in an improved manner. So we'll be talking about how to prepare the brain for that, how to train the brain. And then I'm going to also touch on that mental health or your how you feel about yourself is really critically important as well. And so we're going to be looking at some things that can help that process out. And then also look at the concept of mindfulness and go over some practice strategies for mindfulness. And so we're going to be covering a couple of different things and then looking at some things that you can do to optimize the benefits of physical therapy. So let me go ahead and I'm going to go to the next slide. So why exercise? So we know that regular exercise is really essential for everybody. It helps to really improve your cardiovascular fitness. It boosts your immune system. It helps with, it's a tool in terms of weight modification. It also really helps in reducing stress and anxiety as well. And then it helps with improving sleep patterns because that can really be critically important for some persons as well. So now, how can I stay physically active and do so in an efficacious manner? So what I want to do is I want to think about really working towards goals in a slow, methodical pattern. You want to set realistic goals for yourself, and that might entail working with a physical therapist to help you in terms of organizing what those goals will be. And then stepping towards or doing baby steps to help you along that path, doing very simple strategies like breathing techniques, taking a deep breath in. And I like to call that smell the rose and blow out the candle. And then you also want to, as you step through an exercise program, you want to think about the successes that you've attained, so that being able to incrementally improve your activity level and recognize those steps is also very important. You also want to practice the exercise routine on a regular basis, but do so at a pace that's going to be appropriate for you. And if you need to stop or modify or rest for a little while, then listen to your body in terms of what that pace needs to be. So now, in terms of preparing the brain, what you want to think about is a strategy that's called mental imagery. And so what you're basically doing in mental imagery is, in your mind's eye, you're thinking about how that movement is going to sequence itself. And so what's interesting about mental imagery, or just imagining that movement, we actually see through research changes in fMRI levels. And so you can image and see areas of the brain, even though that you're not doing the movement, areas of the brain that are responsible for that movement light up. And so it's a strategy that has been used a number of years with our athletes. And so what we see is it also has a therapy or a clinical analog as well. And so it can also impact individuals with dystonia. So that's a strategy that you can tap into. In terms of training the brain, what you're going to be thinking about doing in terms of really enhancing that neuroplastic change You're going to think about going slowly at your own pace. You want to be patient in terms of what the steps will be. And remember, what's happening here is that you're creating a new habit. And so you want to encourage yourself and allow yourself time to go ahead and create that new habit. And the other thing that we know in terms of neuroplasticity is that the real importance in terms of practice. And so we know that as you begin those baby steps, you want to begin to incrementally layer in more than one training session over the course of the day. And it may just be a brief period of time, but you want to layer in multiple times that you're giving that your brain a chance to go ahead and re-explore that movement. And the other thing that you want to do is, and we'll talk about this a little bit more as we move on, is see if you can get yourself synced to a physical therapist or someone that can coach you through these treatment ideas. That can be quite helpful as well. So let's take a look at one of the exercises that I have in here. And so what you see is it's a very simple exercise called the sit tall exercise. And so to help you perform this, what you're going to be doing is you're going to be scooting yourself. Let's see if you can try to scoot yourself about halfway out in the chair. If you have difficulty and need a little bit more support when you're trying to control the position of your body or your head, and you might need a little additional support, then you may want to get yourself scooted all the way back. In fact, scooting yourself back on a type of a cushion called the obus form cushion with a high back cushion can be quite helpful. And that's pictured in the slide. And so what you can do with if you don't need that support, scoot yourself halfway out. And then what you're going to be doing is you're going to be rotating your pelvis forward so that you're getting more of an extended position of the spine. And what that will do is it'll help to reorient your head on the trunk. And you want to sit as straight and as squared as you can. And you want to try to keep that head in alignment with the shoulders. And then the next thing that you're going to try to do is to go ahead and tuck that chin and the nose back a little bit. Tuck and kind of flatten the back of that neck. And as you do that, you're going to say, and then E. Okay, and then one more time. E. Okay, so that you are linking vocal volume and your ability to go ahead and speak in a louder way with that body posture and alignment, because that can really very much help to improve that. And so this is a relatively simple exercise, okay? Now, I have a couple of other exercises that I'm going to be touching on briefly as I move through the slides. We're not going to take time today to specifically practice these elements, but what you can do is you can go ahead and practice, give it a try at a future point. Or if you're working with a physical therapist, then take these exercises in to the physical therapist and maybe trial some of these exercises out with that person. All right, so the next exercise that you can try is at a later date is a chin rotation exercise. Okay, and so this is really working on ability to move and rotate the head on the neck and the trunk is what you're working on. Okay, so establishing that ability. And then the next one is a bend and hang exercise. And with a bending and hanging exercise, you're using gravity a little bit in terms of helping you with the movement and alignment, so that if you're upright, you've got the more of an impact of gravity against you. The purpose of this exercise is to take away the impact of gravity a little bit by being in more of a bending forward position. Okay, so this might be something that you can trial with your physical therapist. Another one that you can try is an exercise called Reach for the Sky. And that's, again, sitting tall, and then it's either moving one arm, the other arm, or both arms up in like a touchdown position in an attempt to go ahead and complete that exercise or movement. And so by doing one arm at a time, you're getting a little bit of a stretch on that opposite side. So you're getting a stretch of some tissues that can tighten up and impact your ability to effectively move. So this is a very nice exercise in addressing tightness of the trunk and also the upper extremity. Another exercise that I include is the touchdown exercise. And so this is basically not moving just one arm up, but it's both arms up in that touchdown position. And so again, this is really working on stretching out the muscles of the trunk and also the upper extremities to help with your ability to move over the course of the day. Now, in terms of exercises with rotational dystonia, that's basically it's looking at using a combination of different strategies. So it's sitting tall, so the body posture is optimized, going back against that obus form cushion if you need that additional support. And then using a sensory trick. So, for you, you may know a sensory trick that helps to make your movements a little bit easier. So it might be placing the fingertips in the back of the head. It could be placing a finger at your chin or your cheek. So it may be a unique sensory trick that you can play with as well. And so you're gonna rotate in the direction opposite to the cervical dystonia that you have, if you have cervical dystonia. You don't want to hold your breath when you're completing this exercise. You want to relax as you're completing it. And you want your trunk and arms to remain steady with the motion. And so you're going to be practicing this one then several times in the day as well. And then in terms of really addressing strengthening in persons with dystonia, what you're going to want to explore with the physical therapist or think about in terms of your unique expression of dystonia is you want to think about what are the muscles that are dystonic for you. Is it a rotational piece that's occurring? Is it if it's writer's cramp or focal dystonia of the hand, is it more of a flexion piece? It may involve the foot, for example, if you've got focal dystonia in the foot. And so you want to think about what muscles are involved in that dystonic posturing that can occur. And then what you want to do is you want to strengthen the muscles on the opposite side. So if the propensity is to rotate towards one side, then what you want to think about doing is strengthening the muscles that go in that opposite direction. And so it's countermanding that stronger dystonic quality. And so that's another piece that you want to be thinking about as well. And then in terms of sensory tricks, I talked about this a little bit with that one exercise. So some of the ones that individuals will talk about is finger at the side of the nose, finger at the mastoid process, so behind the ear, on the chin, behind on the groove of the head, or the skull, the occiput is what it's called. So touching a area can sometimes help in dampening down the dystonia for a brief amount of time, and then allow you to more engage in the exercise routine. So the other thing that is really very robust is looking at mirror therapy. And mirror therapy is utilizing your other senses. And then in this situation, it would be using your vision. And so sitting tall in front of a mirror, you basically use that visual cue of the mirror as to where you are. But what you want to do is you want to also retrain your sensory system as to what exactly is occurring in terms of that motion or movement. And so I'm gonna briefly go through this one because it does it would be beneficial if I explain this in a little bit more detail. So in the mirror exercise, you're going to sit in or stand in front of a mirror. You're going to again use that relaxation, the breathing technique of smell the rose, blow out the candle, and then you're going to close your eyes, okay? And you're gonna go into that a more erect sitting position, okay? And so you start off not quite as an erect position. You close your eyes. You see if you can get yourself up into that erect position. Once you think you've accomplished that, go ahead and open up your eyes. And you wanna look at how does your posture look as compared to what your body is telling you is happening. And you want to see, oh, I can go up a little bit higher, or I can tuck my chin a little bit more, or I can correct my shoulders a little bit. So you want to go ahead and cue into those signals that your body is attempting to tell you through either proprioceptive feedback, sensory feedback, or other sensory systems as well. And so it sounds like a very simple exercise, but this is actually something that can help you to recognize when you've attained a more accurate position or a more optimized position as compared to maybe previously. So it gives you kind of what we term in the literature an internal reference of correctness. So it helps you to know a little bit more from the sensory picture in terms of what's going on. And so this is another strategy or tool that a physical therapist will employ. Other exercises that I wanted to include in this are exercises that you might want to tap into and try. And so I added a couple of links. And so there's a link here to seated yoga exercises for beginners. And so it may be something that you'd elect or decide that you'd like to go ahead and try out. What you could do at the start is maybe watch the video and then sample some of the exercises that you think you might be interested in trying. What I suggest doing is start slow. Maybe pick one of the exercises and try that. And then as you are proceeding forward and improving with the yoga strategies, then advance the number of exercises that you do, but layer it on in kind of an onion layering fashion. Okay, so don't go too far too fast, but pace yourself appropriately. And then another complement that I thought that some of you might be interested in learning about is Tai Chi for beginners. So again, this is a video link to seated Tai Chi exercises. And you would want to use that same strategy of viewing the video first and then selecting just one of the exercises that you could perhaps try. And then again, layering it on nice and slowly. So use that same strategy that you do for the yoga exercises. And then another another thing that I wanted to go ahead and explore is really making sure that to get into a regular exercise program, it's really establishing a routine or a habit. And so as you feel comfortable as going back to a face-to-face experience, then then some of the things that you can do to step out to really get out in the community, get out and try physical therapy again on a one-on-one basis. It is basically to look around for a physical therapist that has an expertise in neurologic rehabilitation, or in working with persons with dystonia would be something that would be quite helpful in looking for. Individuals that could possibly help you out in terms of locating that person. One might be speaking with your neurologist and finding out if there is a physical therapist that they refer to in your geographic region. So that might be one possibility. Second possibility would be that's not a go, is to look at tapping into the support group, perhaps that you're involved with. So the support group leader or other persons in the support group might have an individual that they're experienced with working with and can make a suggestion. And then third possibility would be to go ahead and reach out to DMRF and see if they can be a guide as well, or to link you to a therapist that can help you with locating someone in your area. And then beyond just the physical therapy, you want to also look at getting out and doing things that you enjoy, that bring you joy on a daily basis. So it's going to be all sorts of different flavors. So it may be family activities, it may be participating in book clubs, or it could be volunteering, or it could be working, or it could be participating in faith-based groups as well. The other thing to remember is you want to pace yourself through the day. So you want to make sure that you're active, but that you're allowing yourself rest as well, and so that you've got your well-balanced type of a situation. And the other thing that you want to do is kind of linked together is by helping someone else out. Sometimes that really feeds us in terms of helping us out, and it allows us an opportunity to be kind as well. And then the other thing that I wanted to make sure that you are comfortable with is don't be afraid to ask questions. So if you feel like you need help exploring these strategies, don't be afraid to ask questions. We're going to be allowing time in this webinar, but reach out to the neurologist, to your physical therapist, to your support group leader, etc., to go ahead and gather in some of that assistance. All right, very good. And then if you feel like you also need a little bit of help in terms of the anxiety and stress that we've all had to go over the last couple of years, and dealing with the issues and challenges related to dystonia, but by all means, feel free to reach out and ask for psychology or psychiatric support as well. So to a psychologist or a psychiatrist, it could possibly be of benefit as well. Some of the other things I thought would be on the fun side, for those of you that don't as yet feel comfortable getting out there, I wanted to give you an option of getting out there, but through a virtual links. So I have a tour of the San Diego Zoo, awesome zoo. I live in Southern California, and I've been there many, many times, and can give 2 thumbs up on that. Yosemite National Park is in California. I love that. Yellowstone is a lovely park as well, our first national park. San Francisco is a very cool city to go and visit. Washington, D.C., especially at the time around spring and when the cherry blossoms are blossoming, is a very special time as well. And then I included San Diego 360 visit that can perhaps be kind of fun for you guys as well. All right, so the next thing I'm going to talk about is mindfulness. And so mindfulness is really organizing and maybe modifying how you look at things. And so the benefits of mindfulness, research has found that the regular use of mindfulness really helps to manage anxiety and stress in our lives. And it also, if we can decrease the anxiety and stress, it's been shown to promote our ability to focus, mental focus, our memory capability, and our problem solving capability as well. And then it has an ability to really give us a chance of feeling and expressing joy as well. And so the concept of mindfulness, and we're going to be going over some strategies of implementing and practicing this in the next slide. But mindfulness really allows us to be flexible. It allows us an agility to kind of move from and focus on pleasant experiences or activities or memories. So it's a strategy that could possibly be quite helpful for you. So in terms of mindfulness, practicing mindfulness, excuse me, includes really practicing our observational quality. So what do you see? What are you hearing? What are you smelling? What are the body? Do a body scan. What are the body sensations that you're experiencing? Think about during when you're breathing and you're attempting to breathe deeply. How deep does it go? Can you feel the movement of your abdomen, your stomach, or your trunk as it expands in the different planes of movement? So you want to get a sensation of breathing in and out. And then what are some fleeting thoughts that are coming and going as you're thinking of it? And then you want to also practice describing. So what you see outside your body, what are thoughts, feelings, and body sensations inside your body? And then practice describing your breathing as well. And then you want to also practice participating. So maybe moving to music, singing along to a favorite song, singing in the shower, taking a walk, or getting outside and noticing maybe 3 things that you have not noticed before. And so you want to just practice being in the moment is what the mindfulness is. So the other thing that we want to do is use nature as a way of really encompassing and bringing on joy as well. So try taking a walk in your yard, at a local park, in your neighborhood. Get out and garden, or get out and do activities that you perhaps enjoy doing. So enjoy the great outdoors and the beauty of it all. So in this first slide, what we did is we looked at the importance of exercise, how it really helps not just in issues of dystonia, but it helps us in terms of a plethora of things: stress management, sleep, immune system boosting, etc. And you want to go ahead and engage, but you want to go ahead and promote not only the exercise, but think about wellness, think about improving mindfulness, and then navigating, basically slowly trying out different exercises that look intriguing to you as well. And then you want to think about eating healthy and getting optimal sleep as well. So I'm going to stop share of this particular slide deck, And then I'm going to go ahead and pull up the other slide deck. And what I'm going to very briefly cover this, because I'm hoping this one will be a tool for the physical therapist that you go to, or if you're interested as well in looking at research, physical therapy research in persons with dystonia, then by all means jump into this handout as well. But what I did is I went ahead and looked at articles that were relatively recent. So over the last 5 to 8 years approximately is what I looked at. And so I wanted to look at the evidence-based principles of what physical therapy offers in persons with dystonia. And so I'm hoping that you can bring this to your physical therapist and maybe use this as a resource for them. So you may be working with a physical therapist that perhaps might not have a lot of experience in working with persons with dystonia. And so this might be a jumping off point in terms of what the literature is in best helping that person, you out, okay? So this is more targeted toward physical therapy, and so it basically defines some of the definition of dystonia. It goes into pathophysiology, it goes into the mechanisms that contribute to it, and then what's the role of or purpose of physical therapy. And then I go in a lot more detail about motor learning here, and then cover non-motor symptoms that can appear as well. And so I'm basically saying, please read this as a physical therapist. Use this as a reflection in terms of thinking about exercise principles for your patient or person with dystonia. So here it talks about a definition of the different types of dystonia, pathophysiology associated with dystonia. In terms of cervical dystonia, it goes over some of the more classic issues or challenges. What's our current thought process in terms of underlying cause, and what's the aim of physical therapy? Okay, so what do we as physical therapists want to accomplish? And then I go into a lot more detail about the 10 motor learning principles that promote neuroplasticity. And so it basically goes over each of the different 10 and why they want to think about implementing those as components of the exercise program. And then as you are the person with dystonia, are first stepping into an exercise program, and you are relearning a more optimized movement strategies, then we know in therapy that there are different stages of the learning process. So cognitive stage is the beginning, associative is the middle, and then someone who's highly skilled is autonomous. And so it's going over that for the physical therapist as well. And then I also wanted to discuss some of the non-motor symptoms that can be a factor for persons with dystonia. And then I hop into several articles. So there's several articles that look at long-term specialized PT and cervical dystonia, outcomes of a randomized controlled trial. So what does the evidence, the literature show in regards to treatment? And then neurorehabilitation in dystonia, a holistic perspective. And then what's the tip of the iceberg that you see? And then what are some other factors that we need to think about in physical therapy? And is the individual appropriate just for physical therapy, or should they be referred to other specialists as well? So psychology, psychiatrists, I talked about already. But if you had focal hand dystonia, maybe occupational therapy would be someone that you would definitely want to work with. Or if you have laryngeal dystonia than speech therapists. So looking at what are the elements that are unique to that specific person that has the issues and challenges. And then quality of life in idiopathic dystonia, a systematic review. So looking at 75 articles and what are some assessment techniques and assessments that are used. So it really gives the therapist a little bit of a kind of a overview on that. It looks at what are some types of dystonia that were tapped into in the systematic review. And then there is research that looks at Botox or botulinum toxin therapy and how Botox and botulinum toxin coupled with physical therapy in persons with cervical dystonia render a better outcome than if you did just the Botox. And then here's another article looking at MRI and CT images of persons with dystonia, and then characterizing some of the more common postures. And then I gave the physical therapist some references that they can go back to and look at the articles in its entirety as well. So these are a couple of the different tools that I wanted to go ahead and make available to individuals. So now I've talked a whole long time. I wanted to go ahead and perhaps open up some time to go ahead, do some question and answers.
Thank you so much. That excuse me, that was great. You take a sip of water, and I think we all have the seasonal, frog in our throats. But thank you very much, Dr. Hudson McKinney. That was terrific. I should note, I failed to note at the beginning that you have offered to make these slides available as handouts. So anybody who wants them, we're happy to send them along, and we'll make that request. We'll offer that in the email that comes with the link for this program. So lots of questions that we received before, and a number of questions during the program. So let me just start with, you talked a bit about, sort of finding the right physical therapist, helping them understand dystonia. Can you explain a little bit about what a neurophysical therapist is?
Right. So a physical therapist, let me go back and just say what a physical therapist is. So a physical therapist is basically a person that's gone through and gotten a clinical doctorate. And so it's several years of schooling, it's internships, et cetera. And so then they take the licensure exam. Once they pass the licensure exam, they're out in the field and they're working with a variety of patients. And so a neurologic physical therapist is someone who has 3 to 5 years of experience. And it's board certified through the American Physical Therapy Association. And so the individual puts together a portfolio that shows that they're published with articles looking at neurologic physical therapy, that they treat and see a variety of individuals with neurologic disorders. They might have published a book. So it's basically compiling a portfolio. And then once they do that, they take an exam. And so after they've passed the exam, then they are deemed a neurologic physical therapist, and they receive that for a 10-year period of time. And then every 10 years, they need to go ahead and complete that certification process again.
So they are physical therapists who are familiar with neurological conditions like movement disorders, like dystonia and others. So correct. They have a leg up, so to speak, on another physical therapist.
That's correct. Yeah. That's correct. But the one of the reasons why I gave the packet of information is because sometimes in some areas of the country, locating a neurologic physical therapist might be a little bit on the challenging side. So that's why I wanted a resource that if you locate a physical therapist, a good physical therapist, in my mind, is someone that cares about the patients a lot and really listens to what your unique issues and challenges are. And if you feel like you've got that connection, but they don't have experience in working with persons with dystonia, I wanted to provide them a resource that they could basically get familiarized and educated in that unique element.
That's great. Thank you. And we will certainly, that'll have an enduring resource because we'll be happy to share that. We had a question from actually someone in advance of the program and then also during the program. So their physician is not convinced that physical therapy has benefits for dystonia and therefore will not make a referral or prescribe it. And because the physician won't do that, the physical therapy is not covered by insurance. I mean, do you have advice? We could certainly make sure this person gets the packet with all of the literature that you cited, but other advice that you might have for people who want to talk to their physicians, their treating physicians, about the benefits of PT, but the physician may be somewhat skeptical.
So I would definitely suggest taking in the packet to the physician would be helpful. And then I would, so from an insurance perspective, it doesn't require a neurologic, doesn't require a neurologist to refer the patient to the person to physical therapy. It could be a PCP, primary care physician, for example. And so the other is possibly looking at other individuals in the practice. So the physician neurologist might work with a physician assistant or a nurse practitioner, or so it may be having a conversation perhaps with that other person of, is there any way that we could just give this a try, and just see if this is of merit at all. Might be something to consider.
Right. So good advice. If your dystonia treating physician isn't necessarily supportive, your internist or your primary care provider may be. And I think once that physician referral is made, most insurers, carriers will cover physical therapy. Mm-hmm. There may be limitations on the number of sessions, but that really would differ.
Per the insurance coverage. Yeah.
Mm-hmm. So we've had a couple of questions about physical therapy exercises or ideas that might help people who have cervical dystonia and have a head tremor, or who might be unsteady. Some people who have a head tremor are mm-hmm. somewhat unsteady. Their balance is affected. Mm-hmm. Do you have thoughts on things that people might do to sort of strengthen themselves and address those issues?
So balance is actually something that needs to be looked at as an issue or a challenge. And so physical therapists have standardized tests that are evidence-based, that look specifically at a person's fall risk and balance capability. And so they can do that assessment to see how much of a fall. Does the individual have a history of falling? That's huge. If the answer to that is yes, then the individual needs to be looked at in terms of balance concerns. And so there can be exercises given to enhance a person's balance, reactive balance capability, and balance control. And so that might be a component of the physical therapy program for that particular person.
Okay. We also have a number of questions about the benefits of physical therapy for some of the other focal dystonias, that focal hand dystonia or oral mandibular dystonias, even BLEF. Are there benefits for those types of forms of dystonia through PT?
With the focal hand dystonia, then it's basically working on the David and Goliath, countermanding that dystonic and strengthening up the muscles that are on that opposite side is what you want to be thinking about. And then I would say if it's a focal hand dystonia, working as with an occupational therapist might be something that would be in order. So it might be basically utilizing the splints, et cetera. And then there was something that came up there. So dry needling, there's different specific techniques that can be tried depending upon each of the individual. That would have to be explored person by person in terms of the specific techniques.
Right. And just to
And
follow
then
up sorry,
in
go ahead.
terms of the oral mandibular, I would also suggest working with speech therapy in completing some exercises as well to address the oral mandibular concerns or the laryngeal concerns as well. And then you mentioned blepharospasms.
Mhm.
So with the blepharospasms, that's the orbicularis oculi. It's a spasm of the circular muscles of the eye. And so oftentimes what happens there is it's like the cervical dystonia, individuals that receive the Botox injections to the orbicularis oculi muscle, those individuals working in concert with physical therapy can help to go ahead and countermand that issue and concern as well. So that tendency to close the eyes down. So,
Yeah, thank you. That's helpful. Um, we had a question about just a follow-up question about the tremor, the head tremor. We talked a little bit about the unsteadiness that needs to be evaluated, but are there specific exercises that you're aware of that can help to mitigate the actual head tremor?
So the strengthening exercises in terms of holding and controlling, so increasing the strength of those muscles can help. Use sometimes if there you might be able to stabilize the chin as well if you're doing an activity. So placing the forearm on the table, placing the chin gently on the fingers can help to go ahead and decrease that tremor, but it's strengthening the neck stabilizers that will be a critical piece. So
Okay, great. You talked about the importance of exercise, and I think more and more we learn about the importance of exercise for everything. We had a question from somebody who participates in full body strength training, and feels really strongly about it. This person has lumbar dystonia, and is wondering if his strength training and commitment to that maybe be doing too much that might be exacerbating, or is it helping to control the dystonia? I mean, can you do too much exercising?
so you want to go ahead and listen to your body. And so if you're feeling like it's the dystonia is exacerbating, it may be that's where I'm a big proponent of layering on one exercise at a time, so that if you don't respond well to a particular exercise, then you can eliminate that exercise or explore what position or body posture you're assuming as you're completing that exercise. So it may take a little bit of analysis in terms of thinking through, is there one or a couple of exercises that person is completing that they're experiencing more symptoms during that exercise. And then they might want to go ahead and peel back on those and hold those for a little while, and see if, you know, critically look at how they're performing those exercises more distinctly, to help to see if that might be an issue. Their body posture and alignment as they're doing it might be an issue. They might be attempting to lift too much weight or go through too much of a movement excursion. So that would need to be analyzed a little bit more. And so working with a physical therapist, or you know, in their situation, maybe they're an exercise coach that they're working with, you know, analyzing that might be of critical merit.
Yeah, I think you raise a couple of points. One is, how should people feel after they've had physical therapy? Should they be sore? I mean, you know, generally speaking, how do you feel? How should someone feel after a session?
So they might have a little bit of soreness from 1 to 2 hours, but it should not exceed that. And if they have severe pain, if they're in a lot of pain, then that's something that they need to go back and talk about. And so so really keeping that open line of communication is going to be of real critical importance.
And how effective is telehealth physical therapy sessions for people who do live in those more remote areas, who may not have access really even to, you know, physical, not even a neurophysical therapist, but just a physical therapist?
Yeah, so you know, it's something that's relatively new that it has expanded quite a bit since the pandemic. And for some individuals, it can be really a wonderful type of avenue where they're able to work with, if they, so for example, if they can't find a neurologic physical therapist in their area, but they telehealth with a neurologic physical therapist, then that person may be able to derive a significant amount of benefit from that. But is it something that's going to be beneficial for all individuals? I would have to say no. And there are some individuals that really benefit from that one-to-one kind of connection, and need more that being there physically present with a physical therapist. That so you kind of have to know yourself, but it may be, if you're in a geographic region that doesn't have a whole lot of specialists, then it may be a wonderful avenue for you as well.
And I neglected to say, and should have, anyone who's thinking about starting an exercise program, you want to just touch base with your doctor before you do that. We want to make sure that everybody's safe as they start into this. So we had a question, and I know I saw in some of your citations, the question is, are you familiar with Blayton's exercises? And
yes, that's actually in the article. So Blayton is a physical therapist that published in about 2010. And then the exercises have been advanced since that period of time, but that really focuses in on working on the neuroplastic changes. So how can you promote the neuroplastic changes and getting the individual actively involved in the exercise program so that they become aware of when they're doing a movement more optimized and when they're doing a movement not so optimized, and getting a sense of kind of that internal reference of correctness, or the more optimized movement pattern. And so that all steps into that. So yes, that's part of the current research little handout that I have. Yes.
Yeah, terrific. And is muscle memory a real thing?
It is a real thing. And so we can, muscle memory, it's that it's using that sensory system, and getting a sense of understanding the movement extent, the quality of the movement, the pacing of the movement. And so it's muscle memory is definitely a real thing.
And then we had a question based on STRC exercises. Do you know what that is? STRC.
I'm not familiar.
Okay, well,
Spasmodic torticollis. Is it the old term? Are they spasmodic torticollis?
we'll look into it and get
Okay.
back to the
Okay.
individual who presented that question. And then we had some other questions that are sort of, some of them are more dystonia generally, that we'll try to get back to people asking about the diagnosis process and some specific questions. So we are unfortunately out of time, but this has been really, really very helpful. Thank you so much, Dr. Hudson-McKinney, for sharing your expertise with us and helping us to better understand the benefits of physical therapy for people who are affected by dystonia. Again, we will get the link out to everybody who participated tonight and give you the option to request those handouts that Dr. Hudson-McKinney has generously offered to us. And again, thank you very much for joining us. Thanks everybody for being here. It was terrific. Thank you, everyone.
My pleasure. Thank you so much.
Bye-bye. Thank you.